If you could take a test to determine if you had a link to cancer in your DNA, would you take it? My partner Tatum Hubbard joined us now with her special report on the pros and cons of the cancer test. Tatum?
Jay, thanks. This is a topic that's very near and dear to my heart. As many of you know, my mother was diagnosed with breast cancer 10 years ago and went through extensive treatment to beat the disease. So when I heard about a simple blood test that could detect if you have a genetic link for the disease, I wanted to know more about it. And I learned it's a huge medical advancement, but one that also comes with some big decisions.
5 women, all part of the same family, sit around a table. They're not chatting about the latest fashion trends or even the movie they saw last night, but a much heavier topic.
We've seen it so much in our family with people getting the treatments, getting chemo, doing all that. It's just like, okay, who else? Here we go again. Yeah.
They're talking about cancer, breast cancer specifically, and a new DNA test that can determine if you have a genetic link to the disease.
It can be empowering. You can, by knowing, prevent cancer. You can prevent dying from cancer. And if you can't prevent it, at least you can detect it very early when the treatment is easier and the cure is better.
But with that knowledge comes a complex range of emotions and a series of decisions that have to be made. Rosie Gonzalez tested positive for the breast cancer gene, so she insisted that all 4 of her daughters be tested as well.
What were your results?
I was negative.
Negative.
Positive.
Negative.
Relief for most, but not all. 21-year-old Cassandra was the only sister to get the bad news. It was a devastating blow for everyone, especially her twin sister, Jessica.
I'm glad we know and she can take care of it now.
While Cassandra is still processing the news and her options,
Makes me nervous, makes me scared for the future. I don't know what to expect or what to do.
But you want to have a family.
I do. Then it makes me nervous that they have to get tested, so it's a hard decision.
her mother quickly decided that even though she doesn't have breast cancer, she would have a double mastectomy, which reduces her chances of developing the disease to almost zero. Dr. Joe Kazor is a radiation oncologist at West Texas Cancer Center in Odessa. He administers the test and also provides the counseling that a patient needs.
Even though it's still shocking when a positive test comes back, they're hopefully already kind of mentally prepared, being proactive, thinking of this is what I'm going to do, so that we can get past that shock and anger and fear and depression stage quickly, and then move on to what we really want to do is prevent cancers, use this as an empowering tool to save lives.
Carriers of the breast cancer gene have a 50% chance of developing the disease by the time they are 50 years old. By contrast, that number is just 8% for those who do not have the gene. Because of the increased risk, many consider this test a matter of life or death.
Well, nothing in life is guaranteed, but I have a better chance. I want to know so that I can do something about it.
So it begs the question, who should be tested for the breast cancer gene, and what happens if you test positive? We hope you'll join us tomorrow night at 10 o'clock for a look at those issues. Jay?